Several infectious diseases like the flu, bird flu, Ebola and polio are on the rise. And measles, which was once declared eliminated in many countries, has re-emerged with a number of cases, hospitalizations and even deaths. Experts say the current surge is due to international travel, pathogens and low vaccination rates. So how great is the risk to the global health system? To discuss this, let's bring in our guest. Joining us from Geneva, Margaret Harris is an epidemiologist and community medicine specialist. Margaret, great to see you.
Great to see you too, Naidu.
There are a number of infectious diseases going around, including the flu, bird flu, measles, polio, Ebola, tuberculosis, and even Marburg flu. Many had been previously declared eliminated. So why are we seeing this reemergence?
So you've mentioned before that the lack of vaccination, the rise in travel, the rise just in sheer numbers of us, and we're more and more crowding together. We're living in much closed spaces, in urban settings, and we're encroaching on the areas that the infectious diseases might happily live, like the forests, and just happily jump from insects into animals, but never get into humans. But we have invaded those spaces, and we've made ourselves a much more attractive proposition for the various viruses. We've seen more spillovers from animals to humans in the last 20 years than we've seen in the previous century.
Now, the flu has been surging around the world as well. Influenza A, specifically the H3N2 variant, it's resulted in people being hospitalized, and it's resulted even in the deaths of people. I mean, what can you tell us about this variant?
So influenza, and this variant has indeed caused a lot of suffering in communities around the world. Influenza is always a potentially deadly disease. Unfortunately, people sort of disregard any sniffle as a touch of the flu. But the reason the French call it la grippe is it knocks people out. And if you're susceptible, if you've got, say, an underlying condition, or you're ill from another current respiratory illness, or you're a small child, you can get severe pneumonia and you indeed can die. That's why we recommend vaccination to mitigate the effects.
We're also seeing extreme health crises in places like Gaza, in Sudan, in Haiti, in the Democratic Republic of Congo as well. I mean, how do conflicts, and in the Gaza case, what a UN panel calls a genocide, how do they play a role in outbreaks of the kinds of diseases that we are talking about?
So conflicts really put the opportunities that the infectious diseases have on steroids. You know, they make it a perfect storm because you have destruction of the health system, you have damage to people's immune system, both from the physical suffering they experience, but also the extreme stress they're under because of the uncertainty, because they lack sleep, they lack food, they lack clean water, they lack shelter. So these are the perfect conditions for any virus to get into a population and spread very rapidly. And it's also perfect conditions for a virus to turn into something very nasty that could threaten the rest of the world. So we're really not helping ourselves by inflicting such damage on another group of humans. We're actually creating a situation that can make life a lot worse for the people attacking the other group.
Margaret, to what extent is the effort to counter these outbreaks dependent on sound decisions being made by those who lead healthcare programs? I mean, we see in many cases that decisions that are being made are not made on the basis of science and not made on the basis of being well informed.
This is fundamental, and this is why you bother having a global health agency like the World Health Organization, but also why you bother having regional health agencies like the CDC to collect information, to analyze the science and make a decision on what the on that scientific information. But you have to do more than that. you look at the science and you look at what the science is telling you, but you also look at how it can be applied, how people can apply it effectively. So when you give people a recommendation, or you give governments a recommendation, or you give individuals a recommendation, you also have to give them the means to apply it. So there's no point in me telling you, for instance, that you need to wear masks if there are no masks available in your community, or if it's something that is culturally very, very difficult to accept. I have to find a way to make that possible for you. So the science is important, but also making sure it's something genuinely actionable.
Now, on the continent of Africa, we've seen that many people are facing cholera outbreaks, and that's due to heavy rains and flooding as well. Last year saw the worst outbreak in 25 years. There's been more than 300,000 cases recorded there. So that's another challenge, climate change. I mean, how is that affecting these disease outbreaks?
This again is another accelerant. So as I mentioned earlier, that we are encroaching on the natural environment where a lot of the infectious diseases that could threaten us are happily living, cycling away in the animal kingdom and leaving us alone. But we are now changing the environment, and we're also making it more appealing for, say, pathogens like malaria to come to where we live, because we've made the climate warmer. So by damaging the climate, we are giving much greater opportunities for infectious diseases to threaten us. And we're also putting ourselves in a situation where our immune systems are not going to cope very well. We've seen massive heat waves, for instance, and this puts enormous stress on the human physiology. So you mentioned flu or another virus that when you're normally immunologically strong, you might be able to throw off, but when you're immunologically weak, it can make you severely ill or kill you.
You know, so much of this is driven by politics, driven by ideology as well. We see the United States has withdrawn from the World Health Organization. It's not paid its dues. Those dues amount to something like, well, it's between $260 and $278 million. I mean, how will this affect WHO operations around the world, and especially the provision of vaccines in low-income countries?
So indeed, the withdrawal of the United States, and it's actually 2 years of dues that have not been paid, and also what also hasn't been paid were very, very generous voluntary contributions that the United States used to make, and that accounted for 20% of the World Health Organization's budget. So they've had to respond by cutting staff, because that is the major cost in a public health organization. It's the cost of people. So sadly, many departments have been cut by 50%. Now, that does not mean the work won't go on. And vaccines are a separate issue. There are various mechanisms for purchasing vaccines. UNICEF purchased many of the vaccines for childhood vaccination, and Gavi, the Vaccine Alliance, also purchased vaccines for countries that can't afford their own. So that's a slightly separate issue, but the work to do the surveillance, the work to organize the vaccination campaigns, all those things are done by people. And the expertise to monitor the viruses, to look at what's emerging, to look at what can be done, is also done by people. So it is a big problem.
And to what extent will the solution have to come from a very comprehensive approach, Margaret? I mean, you were talking about things like, viruses passing from animals to humans. I mean, would we have to look at migratory patterns? Would we have to look at things like demographics in many countries?
Indeed. When you look at demographics, you know, for instance, what your population is most likely to be susceptible to. So a population with a large group of under fives has got different issues from a population where you've got the pyramid shape where most of your population is over 60. You will have different issues. So demographics are really important, migratory patterns are really important, but what is critical is continual surveillance and preparedness work, because it has been enshrined in the pandemic accord, but it must be applied.
Right. Now, the WHO has made some suggestions, preventative measures. It says countries can implement taxes on things like alcohol, tobacco, sugary drinks. Will they work?
They do work. Implementing those taxes, we've seen in countries where they've applied those taxes, we've seen a big drop in the use of those things that harm health. And when you're approaching something that harms health, like tobacco, you need to do it at all levels. So you impose the taxes, sure, make it more expensive, but you also try to change behavior patterns. So banning smoking in the workplace really helps, because if you're a smoker, you just can't do it for 8 hours. And that helps all the other people who don't smoke. But also you have to ensure that you've got good medical services to assist those who are addicted to tobacco. It's the most addictive drug we know. So you have to work at all levels and have a lot of different strategies in order to eliminate a health threat like that.
Margaret Harris, thanks for joining us.
It's a pleasure.
We now continue our conversation, taking a look at the United States' response to these infectious diseases and the Trump administration's public health policies. I'm joined in the studio by Eric Feigl-Ding. He is an epidemiologist, health economist, and chair of the Department of Public Health at the New England Complex Systems Institute. And from St. Louis, Dr. Ziyad Al-Aly is a professor of medicine and physician scientist at Washington University in St. Louis. Thanks to both of you for being with us. Ziyad, the United States is seeing a surge in cases of measles. Now, this is a disease which the World Health Organization declared eliminated in 2000. That was 26 years ago. So why are we seeing this comeback?
Well, it's unfortunately due to lower vaccination rates. You know, these viruses are opportunistic. Whenever vaccinations rate decline or people stop vaccinating for measles, they see an opportunity and start infecting people. And that's really what's happening in Texas, leading to avoidable number of measles cases and in some cases hospitalization and 2 deaths so far in children with measles.
So if we're seeing a surge in cases, Ziyad, I'm guessing here that the cure or prevention in this case is relatively simple. It's to resume a high rate of vaccinations.
Well, that's exactly right. So, you know, vaccination is the key here, is to really promote uptake of vaccination among kids. You know, that's really, really important. And as you mentioned, you know, this was eradicated 26 years ago. And the reason it was eradicated was really, you know, massive vaccination campaigns that led to eradication. So we know how to do this. We've done it before. We let it lapse now, and or sort of we let our guards down now. Vaccination rates have declined, and as a result, you know, measles have come back, or the virus has come back, and we need to really double down on vaccination to try to put the lid on it.
Eric, as Ziyad says, we let our guard down, so we're seeing this resurgence. Why is that? Is this a relatively new phenomenon?
Well, it's not a new phenomenon per se, but in terms of this era that we now live, you know, vaccination is the key, of course, but we live in an anti-vax era under an anti-vax administration in which appointed as his health secretary the king of anti-vaxxers. So this is one of those obvious conclusions of where we are now. Now, this outbreak, of course, is very unfortunate, and 95% of the people who are infected were unvaccinated or unknown vaccination status. 95% were vaccinated, only 5% unknown vaccination status. But of course, the CDC these days doesn't even point that out. They point out, oh, look at those who got vaccinated and still had a breakthrough infection. Not the fact that, you know, it was the other way around, that the vaccine levels have dropped. But public health is always, I remind people, it's not a pure science. Public health is policy. Policy is politics. And because we have anti-vax politics, we have anti-vax policies, or policies that inherently water down any emphasis on getting your vaccinations. And with the CDC and all these other committees and HHS, we see this. That's the standing protocol.
Yeah, but Eric, in this case, it would seem to be a no-brainer. No vaccines, higher rates of disease. More vaccines, lower rates.
Yeah, but that would be the no-brainer. But the thing is, measles is so contagious, first of all, as Dr. Ziyad has also pointed out, that vaccines are so important. But the pocket of America, even if we have, say, 95% vaccinated in a country or in a state, there will be pockets in which there are very, very low vaccination rates, well below the herd immunity threshold. And all it takes is a pocket of people who are low vaccinated for the measles to run wild. And unfortunately, our society is very polarized. A lot of conservative areas have very low vaccination rates for everything, not just measles, for COVID, for the flu shot, everything. They have very low vaccination rates. And all it takes is one spark to ignite an outbreak in many areas.
Right.
And then domino effects out.
Ziyad, what are your thoughts on health policy and how it is affecting the rise that we see in the cases of measles? I mean, how do vaccines fit into the outlook? Well, for a number of diseases, actually. We look at things like polio, whooping cough, tuberculosis, chickenpox. How does vaccine policy affect all of this?
I think we learned a wrong lesson from the pandemic. I had hoped that people would learn from the pandemic that vaccines actually really prevented a lot of hospitalization, a lot of deaths, and a lot of pain, and a really a significant feat of human achievement that we've really achieved or were able to develop those vaccines and roll them out in less than a year. That's an amazing feat. But unfortunately, we learned the wrong lesson here, and there is a lot of a macro environment now of vaccine misinformation and disinformation. And then, as we discussed, there's an erosion of trust in public health systems and public health messaging. All of that is leading to significantly decline in uptake of vaccination, even among people who previously said, oh, I want to get vaccinated, I would like to get vaccinated. Even these individuals now actually are foregoing vaccination for various things, including flu and multiple other viruses.
And Ziyad, we are seeing another change right now. I mean, these vaccine decisions and advisories are normally made by the Centers for Disease Control, known as the CDC. But now states and doctors are referring to the American Academy of Pediatrics. What is the significance of that change?
I think that's sort of the erosion of trust and the amazing CDC that was and now sort of is heavily politicized and rather dysfunctional. So people or bodies like the Vaccine Integrity Project and other states and other bodies are taking it upon themselves to actually synthesize the evidence, review it, and come up with recommendations on what to do for their populations. I mean, the ideal situation is that the CDC would play that role, but the CDC has become somewhat dysfunctional recently.
Eric, you were saying a moment ago that policy becomes politics, and we look at the politics and the ideology that Robert Kennedy brings to his job. He's been described as a vaccine critic, someone who doesn't believe in it. I mean, he fired the entire CDC Advisory Committee on Immunization Practices. What does that mean for the U.S. healthcare system?
Well, that was devastating. Basically, he cleared the entire scientific committee that recommends vaccines and vaccine schedules, and instead he replaced it with all his people who are loyalists to him, to say the least. And of course, most of the time they vote with him to give him approval. If actually, even recently for some of the vaccine schedules, he bypassed. It was so ridiculous, he even bypassed his own vaccine committee and instituted policy himself. I remind you, the CDC director that was Senate confirmed under Trump also was fired / resigned, forced out. And they don't actually have any CDC director. The acting one was, I think, a George W. Bush speechwriter with no medical background whatsoever. So he's now effectively playing king of all vaccines and taking over the role of the CDC and bypassing the CDC altogether and putting on the committee people who say, like, vaccine efficacy is secondary. We're not really going to pay attention to that as much as vaccine harm. So they're inherently looking for reasons to dilute vaccines. And at the policy level, they have so much power. Not only did they defund billions of dollars in vaccine research, but now they also remove the guardrails that allows people to litigate and sue vaccine makers. And as a result, vaccine makers aren't going to make new vaccines in the future. That was a big announcement as well. So all these policy decisions are only going to fuel not only vaccine misinformation, vaccine distrust, but basically entirely tear down the U.S. vaccine and public health infrastructure to prevent infectious disease.
Yeah, and Eric, to what extent has this been driven by this presidential memorandum which was issued saying that U.S. vaccine policy has to align with Denmark?
Yeah, that was interesting. What they say, well, with peer countries, which interestingly, we're trying to invade Greenland or take over Greenland. So I'm not sure how long Denmark will remain a peer country at that point. But I want to point out other peer countries like Canada, UK, most of the rest of Europe, Germany, Spain. Their vaccine schedules are what our CDC, former CDC, used to have. Yeah. Denmark was always the exception, and inherently there's some sort of ties. Denmark's vaccines very different than the rest, and Denmark is a very different country than the United States with universal health care, which the United States clearly does not have. And so for them to cherry pick that while ignoring the rest of Western Europe and Canada and other, peer countries in Asia is just, of course, ludicrous. They're just cherry picking to water down and dilute and weaken all vaccination protocols. And that's why I feel like American Academy of Pediatrics stepping up and saying, doctors should follow the American Academy of Pediatrics, I think shows great leadership on that part. And as a result, of course, HHS is suing American Academy of Pediatrics. Yeah. But that's inherently the political, litigious world in which we live now.
Ziyad, what is the impact of this withdrawal of funding? As Eric points out, one of the immediate consequences is that we're going to have vaccine manufacturers not manufacturing anymore. But what about the fact that these viruses, they do change, they do mutate, and you require a lot more research to counter this changing virus all the time? Will that stop as well?
Well, that's really actually quite devastating to vaccine research, and it will come back to haunt us because viruses, as you mentioned, are going to continue to evolve and continue to infect people. Pandemics are likely to happen at a greater frequency in the 21st century than in the 20th century. And why is that? Because people are traveling more. People are building in various areas of the world. People are building into forests, and encroaching on animal habitat. What that really means is that it means that humans are going to encounter these wild viruses in the wild, and then that elevates the chance of pandemics happening. So the pandemic that we've seen with COVID is not going to be the only one. There are going to be pandemics, and I fear that we're going to be less prepared to face the next pandemic as a result of these things. Vaccines are really important. Infectious disease research is very, very, very important. Surveillance network and global cooperation are very important. So these are all components that are very important to protect the lives of Americans. This is not about others. It's really about self-interest in making sure that Americans are safe and protected from the threats of infections and pandemics.
And Ziyad, now that we see this resurgence of a disease like measles, what happens to people who have pre-existing conditions? And then, of course, you have people who are immunocompromised as well.
That's universally true for all infections. All infections generally tend to actually affect people who have pre-existing conditions much more severely. And the facts are that Americans are we are an obese nation. We are a nation that has a lot of chronic disease, and hypertension, diabetes, heart disease. So cancer rates are high among Americans. So we're especially vulnerable because actually the discussion mentioned Denmark, where they're definitely, on average, a healthier nation. They have definitely slimmer waist, less hypertension, less cardiovascular disease, less diabetes. And to your point, exactly, all those pre-existing conditions or all those comorbidities actually make us more vulnerable to threats of infections.
Eric, of course, decisions that are made here in Washington affect the whole world, given the United States' position in the world. Well, the U.S. has decided that it's going to withdraw from the World Health Organization. It's not paying its dues. So what happens then to things like, global disease surveillance and, vaccine development around the world?
Yeah, it's very scary. The WHO has to go through a lot of the reforms, unfortunately, right now because of the cutbacks. The U.S. is already withdrawn, and the WHO budget is going to be something of what they have to solve. But the U.S. has also stripped USAID funding, has basically shut down the USAID, which does a lot of global health work previously, and many African countries and South Asian countries are heavily affected by this, and it's very sad and unfortunate that this had to be. I think the America First doctrine of Trump is literally, we don't give a care about the rest of the world, and I think, if we want to have moral leadership in this world, if we're going to be seen as leaders in this world, America is no longer first in leadership of public health whatsoever. And I think we're now dragging the world down, if anything, because of Trump policies and RFK Jr. policies. And as Dr. Ziyad pointed out, our medical research is endangered for the next generation. Universities are being slashed because NIH budgets are slashed, CDC, National Science Foundation. All of this, it's endangering our world now, and it's endangering our children's world in the future. And that's the saddest thing of all.
Okay, that's where we have to leave it. Eric Feigl-Ding, Ziyad Al-Aly, thanks to both of you for being with us. And that's it for this edition of The Heat. I'm Anand Naidu in Washington.